Kerry, I'm Marion, I'm your midwife. I'm going to be showing you around today, so shall we make a start?
Yes.
The first place that you want to go to is the admission and assessment unit. And you turn left and then left again into the waiting area and report to the desk. Okay, Kerry, when you come into this waiting area, it's important that you introduce yourself at the desk. If there's no staff immediately there, it's very important that you ring the bell to let them know that you've arrived. Kerry, we're now into one of the admission rooms here in the admission and assessment unit at Craigavon, and it's in a room similar to this one that your condition and that of your baby will be assessed.
So is this where someone would discuss their birthing plan if they had one?
Absolutely, Kerry, and I would advise anybody to raise that here in this department, because then the fullest range of choices are available to you or not, depending on your condition and that of your baby. I should also say to you at this point that it's really important that you have your Green Hospital notes with you, because obviously all your information about your pregnancy to date is in those notes, and we will need to access that at this point. You might like to see what options you have in terms of the areas for the birth of your baby.
Yeah, absolutely.
Our delivery suite and our midwifery-led unit.
Mm-hmm.
As we come into the delivery suite, the first thing we do is use the hand gel to clean our hands.
Okay.
Kerry, if you're coming in for induction of labour, you'll come from the admission area into a room such as this in the delivery suite. There's 4 similar rooms, and you'll be looked after there by a midwife before you transfer to the delivery room. But Kerry, we've come into one of the delivery rooms here at Craigavon. And in a room like this one, you'll be here during your time in labour, during the delivery, and for a period of time, probably at least an hour after the birth, before your transfer to the postnatal ward.
Okay.
The delivery suite here at Craigavon is the more clinical environment for delivery compared with the midwifery-led unit. And the decision as to which unit you're in is made at the point of admission in the admission and assessment unit. Now, this particular delivery room that we're in has an attached birthing pool room. In a room like this one, we can do a normal delivery, but if there is the need for medical intervention in your delivery, we can also do either a forceps delivery or a vacuum delivery. If there is the need for further intervention, when sometimes things obviously become complicated, we have the operating theatres nearby where we can do a caesarean section. When your baby is delivered, regardless of whether you're here or in the midwifery-led unit, we deliver the baby up onto your tummy, and we practice what's called skin-to-skin contact, and that's really important in that initial time after the birth. It helps to stabilise the baby's breathing, it helps to stabilise the baby's temperature. Of course, it helps with that wonderful bond between you and your baby, and if you have made the decision to breastfeed, it's extremely important in encouraging the start of that to be the best.
And do you have people who specialise in breastfeeding or counsellors at this?
Well, of course, it's part of every midwife's job to give you advice on breastfeeding, but certainly we can give you specialised help if you require it. Okay, Kerry, well, this is one of our suites here in the midwifery-led unit. So I'm going to tell you a little bit about the midwifery-led unit itself and the facilities within it. So would you like to take a seat?
Yes,
on the rocking chair? So it should be hopefully nice and comfy. Is it okay?
That's lovely.
That's lovely. That's good, isn't it? Good back support. The midwifery-led unit has 8 suites similar to this one, and the suite consists of the room with the attached bathroom. There's also another room that has a birthing pool. And you would be admitted here, probably most likely from the admission area downstairs, if you've expressed a preference to come here and if your circumstances are suitable.
Okay.
So you will come into a suite like this in labour. You will labour here, you will deliver here, and you will also stay here for the duration of your hospital stay. We look on labour here as being a perfectly natural event, not an illness, but a normal physiological event. And if everything is deemed to be okay with you and your baby and you're in labour and there's absolutely no problems, then this might be an area you'd want to consider. Here we don't intervene in a labour in normal circumstances. We let it take its natural course. We will certainly offer and use the appropriate forms of pain relief in your labour, all except epidural.
Okay.
Epidural is offered in this hospital, but it only occurs in the delivery suite downstairs. We know that the environment that a woman labours in sort of feeds into her ability to relax, to reducing her tension, and all of that perhaps helps her to feel more in control. There's no compromise in terms of safety, either for yourself or for your baby, and that's always the bottom line. So what we're doing is we're assessing you on admission. We're predicting as much as possible that labour is going to be problem-free. Now, if an emergency occurs during labour, unforeseen, and that can mean a transfer to the delivery suite downstairs, but that would be explained to you at the particular time.
I noticed the CD player when I came in, so you can very much make this as much as your own, bring your own music in, anything that's going to relax you, really.
Anything that works for you, and quite frankly, whatever your musical tastes are. It's all about relaxation aids, and it's all about creating an environment that's conducive to your relaxation. You don't have to be in bed for your labour. There's no compromise, of course, in the standard of safety, so therefore they will continue throughout all of that time to monitor your condition and that of the baby. And when I say monitor, I'm not meaning electronically. I'm meaning that they will be checking baby's heartbeat, they will be checking your blood pressure, and they will be doing a package of care the same as they would in the delivery suite, but in this environment. If you remember downstairs, I showed you the suction and the oxygen and all of those. Well, they're in this room too, but they're behind these doors. The bed is deliberately not central in the room, probably to show the fact that it's maybe not the dominant issue. And we'd like you to be up and about in your labour as much as possible. Up and about or upright. You can be upright in the chair. I hope you're finding the rocking chair quite comfortable because it supports your back in late pregnancy. The birthing mat, you might want to use that. You might want to use the beanbag to adapt different positions. You might want to use the birthing stool.
And all these things, the birthing ball, the birthing stool, the birthing mat, women find these work? They're
Absolutely. I mean, it's a personal preference. There's no right and wrong. It's whatever works with you or for you. The parameters always being safety. But adapting different positions in labour is very important, and it also gives you a feeling of being in control in your labour, and the midwives will encourage that. You also might want to consider the use of water. Have you thought about that at all?
I have actually thought about water.
And what have you thought about in relation to that?
I have thought about a birthing pool, taking into consideration also what pain relief options I have as well. So on that note, can you still take pain relief when you're in a birthing pool?
The thing that I have to say to you is that it's the person best placed to advise you about the use of the water is the midwife in attendance with you during your labour. And absolutely, women find it invaluable during the course of their labour. In this department, we have a piped supply of Entinox, which you might know as gas and air.
Yeah.
And you can continue to use that when you're in the water. And that's very relaxing.
It's reassuring as well.
Absolutely. We can continue to check the baby's heartbeat with the little sonic aid. You just bring your tummy to the surface of the water and they can check it like that. If, however, you were needing the stronger pain relief by injection called pethidine that you might be familiar with, we would ask you to get out of the water for the giving and the duration of that, simply because it has a sleepy-making effect and it wouldn't be considered safe. But you could come back to your bed for that and then remain in your bed for the duration, and you might want to get back in the water later.
Okay.
You can also deliver in the water if it's deemed safe to do so. However, for the purposes of speaking about it, it's maybe two separate things, using water as a pain relief in labour and birthing in water. But that's an option you most definitely have, and a considerable number of our deliveries here do occur in the water. Okay, Kerry, here we have one of the postnatal areas in the hospital, and hopefully, after all that we've told you and all that you've seen, this is where you'll be in a couple of weeks with your little girl.
Oh, thank you so much. I can't wait. I'm so excited.
I hope it's a really good, positive experience for you.
Yeah.